You're all very welcome to today's parent webinar. The first thing I just want to say is, can everyone keep their camera off and turn their audio on mute, please, just so it's less distracting for everyone else. So the three talks today are going to be about neurodivergent children and supporting neurodivergent children. That means children who have thinking, learning, and social differences and difficulties. So that includes autistic kids, kids with FASD, ADHD, DLD, Tourette's, just to give a few examples. So Sinead's going to be talking about the new Edinburgh Psychoeducation Intervention for children, how to use it and the principles of that, and where you can download our resources for using that with your child. Then Miranda's going to talk about identity development and self-advocacy and supporting your child to learn those skills. And then at the end, I'm going to talk about supporting neurodivergent girls through puberty and that time of first periods. So throughout the talk, we're going to just go 1, 2, 3 and not stop for questions until the end. So, but if you can be writing your questions in the chat, we'll be monitoring them throughout, and we'll have time at the end for questions to go through them. So yeah, we were surprised by how many people were interested in this event, actually. So first of all, just to give us kind of a sense of who's here, would you mind writing in the chat just where you're from and how you heard about the event? So something like Dublin, Facebook, or Glasgow, the school emailed me, just so that we have a sense of how best to reach people. So if everyone would like to do that now. And I just wanted to say again is, if you want to be contacted again about events like this in the future, you can just email me the email at the bottom there, and I'll add you to our mailing list for parents. Great. So, and just to say, we're coming at these topics from a professional and research point of view. And now I think Sinead will start.
Okay, so can you hear me okay, Ailbhe?
Yes.
So if you go to the next slide, I'm going to be talking about EPIC. EPIC stands for Edinburgh Psychoeducation Intervention for Children and Young People. And myself and my team have developed this programme to help understand and support neurodivergent children, which, as Ailbhe describes, includes quite a range of children. Not just actually children with those conditions, but also children who have thinking, learning, and social differences, maybe because they were born premature or because they have epilepsy. So next slide. EPIC started out from a research perspective. It was developed from knowledge of research, or a wide range of research evidence, and we developed an intervention. But the intervention was very much co-produced with children themselves, teachers and other educational professionals, as well as parents and clinicians. So we've had clinical teams very strongly involved in the research. And we completed a research study at the end of last year and found that those children who took part in the intervention improved in their thinking, their learning, and their well-being. And this came from a wide variety of sources of information. Over the last 6 months or so, we've been developing a new option, which we're calling the self-delivery of EPIC with support. And we're hoping that we will finish this in the new year and be able to have this available in the community. So this will be an option whereby, with support from the EPIC team, parents and teachers can actually run an EPIC program with children themselves. But tonight I want to focus on the resources that are already available, that parents and indeed teachers are already using, that are available on our website, on the Edinburgh University website. You'll also see them referenced on the blog that we have, which is referenced there. And at the moment on the website, we have booklets The booklets that we have at the moment are condition specific. They refer to understanding ADHD and deicde, although the strategy booklet is general to all conditions. But we're currently developing an understanding neurodivergent children, which will be very similar to the other ones, a little bit more detailed, but also will apply to children with all of these conditions and indeed be relevant to children who don't yet have a diagnosis, which is extremely important when we know about long waiting lists. And next slide, please, Ailbhe. So in terms of, before I talk you through those resources and what they look like and how you can use them, I want to just talk about the EPIC practices. What are the practices that we do in EPIC? These practices are to understand the child and to support them with strategies and indeed upskill them so that they know that they can ask for strategies and identify strategies themselves. So it's 3 Ps basically. The first is profiling, and what I mean by that is using techniques to identify what actually the difficulty is with the child. In the research intervention, we used tasks that we have available, as psychologists, but actually we've got lots of activities in the booklets that parents can use, everyday activities like games, like crafts, to try and identify the difficulty a child has. And just to be a bit more specific, obviously with ADHD, attention deficit hyperactivity disorder, it's commonly assumed that the core difficulty is attention, or even the only difficulty is attention. But we know from our research evidence that many of these children have memory difficulties or planning. They often look different from one another. So one child with ADHD doesn't necessarily look like they have the thinking difficulties of another child. So it's important to use activities and to observe the child to try and identify whether you think it might be a memory difficulty actually that they need support with, or with planning or organization. Or if they're autistic, commonly children will have a difficulty in shifting their attention from one aspect of a task to another. And once we begin to get a sense of what the difficulties are, then comes the second P, psychoeducation. So it's a bit of a fancy word. What does psychoeducation mean? Psychoeducation basically just means understanding that individual child. And it's not necessarily about understanding autism because they have a diagnosis of autism, or understanding ADHD because they have that diagnosis. Because as I mentioned, these children tend to differ from one another. And often children will have one condition, but they'll actually show symptoms of another. So for a child with ADHD, they might be acting distracted, not because they have a thinking difficulty and attention, but because they have sensory difficulties and they find it hard to tune out noises going on. So it's important to understand the child using games and activities or any other ways that you can, but then to help empower the child with a knowledge of not just their difficulties, but also their strengths. Many of these children have interests that they're particularly like to engage in. Many of the children we've had through the intervention, for example, are very interested in crafts or very interested in using Lego. And these are really useful ways of engaging the child and helping them to understand the strengths and the difficulties that they have. And then it's also about everyone in the child's life understanding the child. So both the teachers, those in the school looking after them, and also their parent, understanding the strengths and difficulties the child has. Because we need this understanding before we can then identify what kind of strategies, this is the third P, pairing with strategies, that the child needs. And we really try to identify the strengths of the child and to use these in the strategies. The strategies that we've described in the EPIC booklets include what we call internal strategies, so like thinking strategies. So for example, if there's a memory difficulty, encouraging the child to pair or chunk related items so they can remember items more easily. Or external strategies like using a mini whiteboard or some other kind of planner so they can actually detail steps and remember all of the steps if they're having a difficulty remembering. Planning is often an issue, and these kind of techniques are also really useful with planning and broader organization. And really EPIC is about empowering the child with their understanding of their strengths and difficulties, but really upskilling them. And over time in using strategies and suggesting different strategies for the child, whether that's chunking or grouping items to help remember them, using rehearsal to try and remember them, using mind maps or drawings to try and plan out tasks. The idea is that we upskill the child. So the child knows my memory tends not to be as good as my peers. I maybe don't remember as many things at once, or I need to do it in sequence. And the idea then is that the child just knows that they need to ask the teacher, for a particular type of support, or ideally that they feel upskilled that they can identify themselves, particularly in a new situation, what kind of strategy that they would need. So next slide. I'm just going to talk really now quickly about some of the principles of EPIC before I then go on to talk specifically about the booklets and what the booklets look like. A basic principle of EPIC is that for most children who are neurodivergent, there are multiple difficulties called into play. And if we try and think of the child as just having an attention difficulty, or they have DCD, so they just have a motor difficulty, that does not tend to give us the understanding that we need to really understand the difficulties the child is having, and that's impacting, whether that's them doing a homework task, or completing baking a cake with you at home, or doing some work at school. We mostly focus on thinking because these thinking difficulties often determine the sort of broader learning and difficulties that the children have, particularly in emotional regulation. We often say to parents and teachers when they're overwhelmed by the behavior of a child, think about what are the thinking factors that are underlying that. Often these children get frustrated. We see difficulties in regulating their emotions because they haven't planned or they haven't known how to start a task, and it leads to this frustration. So it's really important to think of multiple components. As I've already mentioned, we focus on the child's strengths as much as their difficulties, and try and think of areas of strengths and use this to overcome difficulties. Diagnosis is not necessary to use this kind of understanding and difficulties. The kind of strategies we use are game and activity based. The ones that we have in the booklets at the moment are most suitable for the primary school years, but we are intending to develop those for younger and older. A really important aspect is that we're not teaching the child. The child is not a passive participant. So we engage in things like Connect 4 with the child and have dialogue with them about taking time to make a move and watching the other person's move, and have a think about whether you really wanted to make that move for to actually basically win. It's very personalized, so we think about what really interests and motivates the child. So if they're really into Lego is absolutely brilliant for lots of things. So for helping a child to think about planning, how are you going to build your house? Let's not use the Lego just now. Let's actually draw out that, and then we'll use Lego and have dialogue with the child about the steps in planning and the steps that you need to take, thinking of the first step right down to the last step before you start. We talk a lot about stop and think in EPIC, encouraging the child to stop and think before they make a move. And as I've mentioned, you're here as parents tonight. It's really important that this kind of awareness of the child's understanding of their strengths and difficulties, and pairing with these kind of strategies and that being available is also available in school, coupled with things like movement and sensory breaks, which we really strongly advocate for. So next slide. So what we advocate is using the booklets. These booklets are free and available to download online, and you can access them using the link there. Any problems with the link, they're on the Edinburgh University website under my name, Sinead Rhodes, and EPIC. They're very easy to find. And it's basically using the booklet to identify, sitting with the child and looking through these aspects, planning ahead, thinking flexibly, what do we want to work on? What seems to be an issue in being able to get out of school, get out to school in the morning? We need to leave at 8:45. What are the aspects there that are preventing that? What are the aspects preventing completing a task, whether that's a game or getting ready for something at home, or it could be more social, like making friends. And we also have in our new booklets list of strengths that we encourage the child to also look at and identify. So next slide. Once the child and yourself have identified the kind of areas that you want to focus on, you can then look at our strategy booklet. We're currently developing a strategy booklet for parents, but actually it's not much different from this, in that just some of the examples in this one are more applicable to schools. So you can absolutely use this booklet that's available online. And as I say, we'll shortly have a specific parent one. So next slide. This will show you the sort of index of the booklet, which details the kind of areas that you can link to, that you can identify and work on. So if you've been engaging in games and you think with a child that you want to focus on memory, you want to help the child to be able to complete a task, and they seem to are forgetting some steps along the way, just go to page 25 of the booklet and you'll see some ideas there, including Ailbhe, next slide. This is an example of one of the slides. And what you'll see with the examples, these things are, behaviors that you can readily do yourself. They're things that you can do at home without needing to, purchase things. So here are a list of sort of internal strategies, like breaking something down or grouping into pieces. So for example, if a child is to remember, a range of items, they could group them based on their color or something else that's similar. Writing it down. Often when children start primary school, they have mini whiteboards, and as they get older, these are taken away. These are really useful and really to use at home for things like all of the steps that we need to do at home before we go out to school in the morning, for example. Or if you're baking a cake with your child or doing crafts, being able to write down the steps. And really importantly, having dialogue with the child, speaking to them about why it's important. Even as an adult, we really need to remember all of the steps. If I forgot to buy the eggs in the supermarket, whoa, we go to make the cake and we can't do it. So writing it down and remembering things is really important. And representing items visually. So for example, if the child is doing, sums, they're doing their homework, using things like Lego, or if they're into Sylvanian families or LOL dolls or little things, use the items to represent numbers. And then, they can do ads, but they're also then active in their learning because they can move the items, they can use them physically. Next slide. So that's me. Thanks very much for listening. I'm just going to acknowledge all the different people that have been involved in EPIC, and now pass you on to Miranda.
Hi there. Actually, Sinead, I'm just typing EPIC into the chat box. So give me a second.
Yeah.
Evening, folks. You can see me multitasking. It's probably not the best look.
Well, you're modelling executive functions. So
yes, yes. Well, I'm modelling some probably poor technical ability more than anything. So apologies, folks. Right, I've put the EPIC link in the chat. You know what? It's so lovely, Sinead. Tonight, we have had a fantastic turnout. So thanks very much to all the parents for turning up, and thanks to folks for putting their location and their where they've heard about this in the chat box, in the chat, sorry, because I was just saying it's really helpful for us to kind of understand where best to advertise and everything. As we're going through as well, like Ailbhe said, it's really helpful if you can put your questions in, because we'll just look at all the questions and can try and answer them at the very end of our session. So I know there's obviously our common kind of thread today is just talking about neurodevelopmental disorders, neurodiversity, and of course neurodivergence, and that's what we're here to talk about today. And obviously as parents, you are the kind of key source of information. You will be the key advocates for your child. So I suppose Sinead has kind of ended on talking about how you speak with your child, and that's where I'm probably going to pick up just now. So Ailbhe, if you can move on to the next slide. Thank you. Oh, Pat, you skipped one. Back one, please. Thanks, Ailbhe. So I know we hear lots and lots of different terms out there, and sometimes I find it's a bit confusing about, all right, what do all these terms mean? How does this actually apply to my child? And I think from a really practical viewpoint, how do we start talking to your kids? How do you speak to your kids about neurodiversity, kind of being neurotypical or being neurodivergent? Okay. And I suppose part of my talk today is really to give you some information and to also kind of think about how that can maybe inform a more positive self-identity for your child as well. Okay, so I'm going to start with this really nice illustration by Sonny Howlett, and it talks about neurodiversity, neurotypicalness, and neurodivergence. Okay, so I'm just going to talk you through the first slide just to illustrate the different concepts, because when we talk about concepts, there's also the language, and it can get a bit confusing, I find, and I spent a lot of time reading and trying to make sense of it myself. So here we've got a really diverse group of shapes. Okay, I'm going to say it's an octagon. There's rectangles, there's squares, there's triangles and circles. So a really diverse group. Okay, but the square is the most common, and they are typical. Okay, and then you find that you've got these other shapes: the circle, the triangle, the rectangle, and the octagon, and they're divergent from the most common shape. So they are divergent. Okay. So if we apply this in terms of kind of neurocognitive function and all the language, we know that our society in itself is neurodiverse, okay? Lots of different individuals, we all have different profiles, different needs, and what you'll find is that you're like your square, that you've got the kind of neurotypical, the most typical population, and then our kids who are neurodivergent from the kind of most common, which is the neurotypical. Okay, so when we're talking about neurodiversity always kind of is a good way to explain all of us, because we're all neurodiverse, and then neurodivergent kind of children, and that was the bit that Ailbhe was talking about at the start, where our kids will be now neurodivergent, so they might have a label, they might have a diagnostic label, so that's a medical term for a neurodevelopmental disorder, and that explains potentially the way they think, they learn, how they experience their world, and how they manage those relationships as well. Okay, can you go on to the next slide, please? So in this slide, because we talk about neurodiversity, neurodivergence, and we also have the kind of constructs of disability, diagnosis, what I've attempted to do here is to kind of is maybe try and kind of show how they can all maybe fit together in some way as well. Okay, so at the very heart of it, of all our lots and lots of circles, is the child or the young person. Okay, and you might recognize that they're living with a disability. Okay, and a disability under the Equality Act kind of actually means that you have a physical or mental impairment that has a long-term impact on your ability to do day-to-day activities. Okay, while we talk that, we can also, we can also think about the more traditional kind of ideas of a disability. It might be an intellectual disability, it could be a Down syndrome as well, but we recognize that there's lots of disabilities out there in society as well. And living with that, it can impact your participation, your day-to-day activities, and your participation and inclusion maybe in different contexts. When we look at the diagnosis, so you might go through an assessment process, your child might go through that, and they might receive a diagnosis. And a diagnosis is just the medical label for that neurodevelopmental disorder, okay? And then it could be a neurodevelopmental disorder like we've talked about tonight. It could be ADHD, it could be intellectual disability, FASD, fetal alcohol spectrum disorder. It could be autism, it could be Tourette's, it could be deicde. There's lots of kind of neurodevelopmental disorders out there as well. What I'm going to add in tonight is talking about disability identity. Okay, now one part of your child's identity as they grow up and they mature into adulthood is relating to their disability. So it's not their whole complete identity, but how they relate, how they see themselves in relation to their disability can be part of how they are as well. And then that's kind of housed within the bigger circle of living within a neurodiverse society. Now, while we focus on the child, that's not to forget all the contexts that are there as well. So it's equally important to acknowledge that your child and you as a family will interact with kind of the public and their understanding of disabilities. There will be the context of home, school, your local community, any sports or any interests that they may have, and how they interact and how you as well might find your encounters with professionals and, kind of talking through that. Okay. And of course, the social support that you might have in your life and in your child's life as well. All equally important factors to remember. Thanks, Ailbhe. Can you move on to the next slide? So when we're having those kind of conversations, lots of different terms out there. And what I've tried to do is start to, I think, in those conversations, it can be quite kind of daunting to think, well, how do I explain this? Some of you will give amazing scripts. And it's really good to share that as well. I think that's really important. So in terms of kind of, if you have kind of concerns about your child, it's really helpful to kind of start these conversations. And we totally recognize that this won't be a one-off conversation. It'll be something that evolves over time and that you return to as well. So in my script department, I've kind of had a few ideas. So in terms of neurodevelopmental condition, you might start a conversation off with, if you have a neurodevelopmental condition, it means that you might have a difference in the way you think and learn. It's very common, which it is. It can affect how you plan and remember things. Oh, sorry, Ailbhe. Or how you manage friendships as well. Okay, there's lots of different examples, and while you might start off a conversation, it's really good to personalize that conversation and for your child to engage and provide examples in that. Diagnosis we've already covered is the name given to a neurodevelopmental condition. Disability is part of being human and can affect children and adults. And it's a condition, can be physical, mental, or neurodevelopmental disorder. And it makes it more difficult for a person to do different things in their everyday life or things that other people can do. Okay. I'm an educational psychologist, but I'm also doing some research with young people in terms of fetal alcohol spectrum disorder. And I actually have a quote from one of them from kind of doing my recent research, because when I asked them, how would you explain FASD? They gave a fantastic answer. And these are their own words. So they said, I would give them the definition of it, FASD, and I'd explain how it works and how it affects me as a person, and give them some examples of like different times when we've been together and how it's come about when my FASD has acted up or something. I try and give them as many personal experiences that they've had with me. So I just thought that was a really insightful explanation of that. When I've been talking to young people with FASD as well, they've also given me, their idea of how to explain FASD. And they've said things like FASD is where some of your brain cells don't work properly. Sometimes they said the person that was carrying me when I was a baby, they were pregnant and they were drinking. So actually, young people themselves, often have the kind of really accurate and really helpful definitions that they feel comfortable expressing as well. Okay, thank you, Ailbhe. Okay, so just coming back to the idea of disability identity, as I was saying, this is just one part of a person's kind of developing identity. And there's lots of different models out there. There's not a huge amount of research on it. So it's really fascinating that, the work that I've been doing with young people, because they've been talking about, I've not used the word disability, but they've actually been using disability in the conversations themselves. And what I've seen is that through kind of late childhood and into kind of late adolescence, you do see in a kind of this kind of pattern of identity formation. So again, when I was talking about disability identity, that's the kind of understanding of self in relation to the disability and in relation to others around them as well. So there's 3 different phases. Again, it's not always going to follow a really clear path. It can stop, it can stay in a phase for a particular length of time. And it can be something that you can revisit as well. So these are all words. It's really good that we introduce these concepts. So And we'll come back to that as well. I can see questions popping up, but we'll definitely come back into that later on. So in terms of passive awareness, it's, I suppose, that understanding that, yes, I've heard of this term of disability, it might relate to me, but there's not a kind of real personalization with it of how it actually directs, affects the person. So sometimes it can be seen as very much, no, that's quite distinct from me, or yeah, I know I have a label, but I don't really know what that means with me in terms of actually living on that day-to-day kind of basis of what it's like to live with a disability. The kind of phase of realization usually happens in kind of early adolescence, and that's where the young person starts to realize the impact that it's having, and a sense of actually that this could be more permanent than they maybe anticipated. There can be the realization in relation to others around them, and usually that kind of happens in a school site because that's where most adolescents are, so, or it could be in the local community. And there can be that stage of either kind of moving on to acceptance, or actually being quite, no, I want to keep this to myself. This is, I don't want to share this. And I think we're just recognizing that, for that young person, is part of a journey. I don't think we can force it, but I think it's just, those kind of conversations where you keep returning. And then we move into the kind of latter phase of acceptance and understanding the impact of disability, and talking about what that actually means, and then starting to kind of, I think, move into a kind of advocacy is what I've noticed as well from the young people too. So as part of that, what we start to think about is, you as parents will be amazing sources of information. You will help those scripts. And also what we need to start, what would probably be really helpful, as especially as those young people kind of move on into adolescence, late adolescence, is introducing the idea of self-advocacy, so that the young person is learning the language, they're learning the times and when to ask for help and support themselves too. So Ailbhe, if you don't mind moving on to the next slide for me. Thank you. So self-advocacy. Okay, so that's, I suppose, for a young person, learning the knowledge and the skills around that so that they can advocate for themselves. Okay, now there's lots of different elements to self-advocacy. Knowledge of self is a particular one, and that's like the kind of disability identity, knowing more information, knowing what that looks like. Do you have a diagnosis? Do you have things? And I'm actually going to talk about how to develop that in the next slide in a minute. And then I suppose what we also want to think is that kind of having that plan and making sure we have those conversations, particularly to develop skills around communication, how to ask for support, maybe having the idea of when to identify support, maybe what, where are the moments that they get a bit stuck? Do they get a bit stuck in school, or is it when they're out playing some sport and actually they're not quite sure what's going on, but actually doing some rehearsal about, when this happens, this would be a time to say to the person that you need some help. Okay, and as part of that is bringing up the kind of, I suppose, the idea of, kind of learning a bit more confidence. So they're kind of the rehearsal, repeating. And I think you as a parent can really help that scaffolding and to kind of guide them through that process as well. It's tricky. It's not easy, guaranteed. Pursuing what you need and why. I think information is really important. And I think it's been really aware that linking your kids into kind of the concept of, neurodevelopmental disorders, neurodiversity, but also disability, and that they have rights. They're entitled to all these things, and they have a voice as well within that. That shouldn't be ignored. Really, really important. Membership at the end, that's kind of usually, that can be at different stages. Like some of your kids will be joined up to different groups, diagnosis specific groups, and that's learning to have a kind of community where that they feel that they can explore that. What does that mean for me? How does it might impact my day-to-day life? What are others saying about it? And just kind of having that chance to explore all those things. Okay, I think we're on to my last slide, I'm going to say, I hope. Right. I hope I've got that right. So knowledge of self. So just having that idea of where do we start with it? Okay, so your child to really engage in a kind of more meaningful conversation. Now, sometimes I think when we start with something really abstract, it can be, that concept of viewing disability. And I know when we talk about it in schools, it's like, oh, we're going to have a celebration for this week or this day or these different things. And And I think it's really important just to start with a conversation of, actually at a very basic level, what's really important and meaningful to your child? Are they really interested in kind of maybe some schoolwork? Do they really like reading? Do they really like art? What motivates them? Okay, that can be a useful kind of way just to engage their kind of interest in the conversation. And then kind of you can kind of, I suppose, elaborate that conversation then to kind of look at how you would have a conversation about, well, if you needed support, if you needed, are there times you ever find it kind of tricky? You can kind of have those kind of conversations, okay? I've provided some scripts around kind of neurodiversity, neurodivergence, neurodevelopmental disorders as well. But in specifically, I would suggest using the terms and getting your child to understand what that means, because we can hear labels, but what does that mean for us? Okay. And sometimes for our younger kids, just explaining, and kind of going through this and looking at strengths, differences, what do you need? What would help you in school? What would help you when you go to after school club? Or, what would you like? Are you looking for more opportunities? And I think feeding that back into kind of, I know we're kind of coming from different places here, but feeding those back into school planning meetings or any school or kind of local community sports or whatever your child is really engaged with. If your child does have a diagnosis, if they're at the stage that you think they're ready to hear that, but just to gently start kind of explaining that as well and exploring as well with them, how does their disability impact their day-to-day life? Okay, so that can be examples of, do you find it tricky to remember things? Do you need help with organization? Okay, so the executive function aspects that kind of Sinead was talking about earlier on, about planning, thinking ahead, kind of problem solving. It might be kind of friendships, okay, and kind of getting access to different opportunities. That might be part of how their day-to-day life is affected as well. I've put up here a fantastic Me and My FASD guide, and I've got FASD Hub, and I see that as well. Yeah, FASD Makes Me animation is fantastic. There's lots of great resources out there. These are Scottish, well, the FASD, sorry, Hub is Scottish specific, but obviously is accessible to everybody. And I think it's just starting those conversations. So cartoons can be really helpful, and then having that conversation afterwards about, oh, what did you think about that? And starting to relate it to the individual, your child themselves, so they understand that as well. Okay, Ailbhe, I think I'm at the end of my slide. I can't see.
Great. Oh, are you? Let me check. Okay, on to
Yes,
mine.
I am. Right, I'll turn myself off. Thanks very much, everybody, for listening tonight.
Great. Thanks so much, Miranda. Okay, so I'm going to go through a quick talk on supporting neurodivergent girls through puberty. So I'm just going to briefly go through these topics, when to explain how children are learning about periods, how to explain what attitude towards periods you should teach your daughter, and sensory issues, and hopefully give you some kind of practical advice for all those things, and provide you with some resources as well. Right, so when to explain. So the timing of first periods is becoming younger for everyone, and this has been a trend over the last century. So about 100 years ago, it was 13.5 was the age most people got their first period, but it's kind of slowly been becoming younger and younger. Now it's about 12, but it can be as young as 8. There is a little bit of evidence as well that says that autistic girls might get their period earlier than other girls. So that's something to kind of be aware of as well. Neurodivergent children often need extra time to process things and might need a lot of repetition. So for these 3 reasons, it's recommended that you talk about periods and body changes quite early, like around 8 years of age. You might be thinking, well, I got my period at 14, so why would I talk to my daughter about it now? She's only 9. But for these 3 reasons, it is a good reason. It is a good idea to start early. And the other thing as well is you might have to initiate the chat. Don't wait for them to come to you and say, what's a period, or is it true blood comes out of your vagina? you might have to initiate it. Right, so how are children learning about periods? So it's important to remember that children learn about a lot of things through memes and TikTok. So oftentimes TikTok and Instagram use overly dramatic images and narratives for humor, but your child might not understand that. So it's a good idea to kind of have a chat with them about what they've seen on the internet about periods. So there's kind of this one of Kim Kardashian and Kanye West. I've seen something like this like 500 times in my life. Like there's always memes about the irrational girlfriend when she's on her period. So they've probably seen it. So it's a good idea to talk to them about it, or this kind of period about this meme here about what cramps feel like. So it's a good idea to say something in the bottom right here. I have suggested scripts like, did you see anything on TikTok or Instagram or YouTube about periods that you were confused about or that you're worried about? Or you can ask them, did they hear someone, you know, in school say something they were worried or confused about? So this is a good place to start because it shows you where they are and it lets you kind of clear up any confusion they have already. Right, so how to explain? So sometimes neurodivergent children are more anxious about their body changing than other children. They just don't tend to like change sometimes. So it's good to start early so that can prevent shock, fear and embarrassment. This is a really good website. It's the HOPE website on the University of Edinburgh website. So if you take nothing else from this, just think HOPE University of Edinburgh and you can go on that, and there's loads of resources in different formats on how to explain periods and puberty. There's also lesson plans for teachers, and there's information about like what's a normal period in terms of duration, you know, what's a heavy period, irregularity, things like that. And then when you do find their preferred method of learning, say you do find a book that works really well, you know, tell the school so that they can use it with your daughter. Then the other thing is to go through the steps with your daughter. So when you're in the local shop, say like this is the part of the shop where you can get tampons or pads, and practice opening the packaging, putting the pad on the pants, pretending that there's blood on it using food coloring, and then teaching them how to dispose of it. And then another good idea is to go through with them like who they can go to in the school if they do get their first period in school. Right, so when you're explaining periods, abstract images like these can be a bit confusing for everyone really, but in particular for neurodivergent children. So you've probably seen like ads on the television using like blue liquid when explaining how pads work, and it is confusing because, you know, obviously it's never going to look like that. It's going to look like blood. So it's good to kind of, again, not use images like these like to explain, just to use quite like photographs are kind of better. So there's this book here called the Autism Friendly Guide to Periods, but it's suitable for any children with neurodevelopmental condition or sensory issues, and they have photographs of pads and tampons, which can be really helpful for neurodivergent children. I'm just going to show a photo, so if you don't like blood, look away. But just using these kind of simple images showing what a pad or tampon will look like when it's used can really clear up anxiety when it does happen. Also around advertising with periods, they can be kind of overly positive sometimes. Like if just once you buy this particular tampon, you know, you'll be able to do tennis or gymnastics or swimming or whatever. And it can be misleading for young girls. So there's no need for an overly positive attitude towards periods, because for the most part, they are a bit uncomfortable. So just it's recommended to use a neutral, factual and open approach. Yes, so with sensory issues, Robin Stewart wrote this really great book, and she talks about sensory issues in two ways. So there's the sensory experience of being on your period and coping with that and what menstrual products to use. So she found in her research the most sensory friendly menstrual products were period underwear, fabric pads, and menstrual cups. So you could try them as they've worked for adult autistic women, but it's kind of just about figuring out what menstrual product works for your daughter. And then the second thing is that there's some preliminary evidence that when a person has sensory issues, when they're on their period or during menstruation, those sensory challenges can be more intense. So say if someone's sensitive to bright lights, it might be that when they're on their period, that's actually more intense and more painful for them. So just to be aware of that and cut your daughter some slack. All right, so I'm continuing to try and figure out some of these things. So I'm conducting the Transition to Teenager project for girls with and without neurodevelopmental conditions. So all girls between 11 and 13.5 are invited to take part. So neurotypical girls, girls with a diagnosis of autism, ADHD, or dyspraxia, or if you're on a waiting list for one of them. So if you'd like your daughter to take part, or if you'd like to help with finding or recruiting girls to take part, please just email me and I can send you more information. So finally, I just wanted to mention the Learning About Neurodiversity in Schools curriculum. This is a project that was developed by our colleagues here at the University of Edinburgh, and it's a new curriculum for mainstream schools which teaches children about neurodiversity and neurodivergent people, and its aim is to promote acceptance and understanding in children. So it's 100% free to use. So I sent an email earlier today with documents that could help you ask the school to teach LEANS. So if you didn't get that email, just let me know and I can send it to you. But it's just, there's a sample letter you can send to the school, just basically saying, I want this to be taught in my school. And it's for all children in the class. Right, so that's everything. I'm going to stop sharing now.
Okay. So Ailbhe and Sinead, right, we're at the end of our session. So I've been looking in chat. So we've got just a few kind of topics that are coming up. First off, there was just a question just around the EPIC material. I know some folks were really glad to see FASD kind of been mentioned and kind of in the advertising and everything tonight. But they were just wondering why FASD wasn't specifically mentioned on the EPIC material. So if you don't mind, Sinead.
Yep. So in the initial...
Oh, your camera's off, Sinead, sorry.
Oh, yep.
Just if that helps.
I remembered to unmute, but not...
Yeah, no.
Not to do the camera. Yeah. So in the initial booklets, we wanted the initial booklets that we produced to be as concise but brief as possible, to be as focused as possible. And we came up with a list of, so many different conditions to include. And the more work we did with parents and teachers, we were coming up with more. So we decided to just focus on a few, and we have a general statement about the booklets being suitable for children generally with thinking difficulties. The next booklet that we're going to produce, because we already have those, we can be more specific. And we are indeed including FASD and other conditions that we didn't refer to. So, like, for example, your difficulties having come about because you were born premature, or because you have epilepsy. And I think there was another question about when the parent booklet will be available. So there are parent booklets on there at the moment supporting children. There's a strategy booklet that says for teachers, we're developing a parent version, but actually it's really, really similar. It's just some of the examples are different. So please do use the teacher strategy booklet. Most of it will be relevant. The parent one should be out in the new year, alongside our new Understanding Neurodivergent Children, which will be the generic booklet that's applicable, that's not condition specific.
Thanks, Sinead. And I noticed, obviously, you've been answering some of the questions coming in on the chat, because I know there's been kind of requests for various neurodevelopmental disorders in terms of DCD, ADHD, parent support groups. So I know you've just mentioned a few. Is there kind of particular ones? And I know parents have been putting that in as well.
I think it's important as well to marry that with, we often talk about these conditions as being individual, but the norm is that they co-occur, that children often have more than one, or they may have symptoms of another. It might not be that they have a diagnosis of it. So actually, some of the organizations that are particularly relevant are, for example, the ADHD Foundation, and although that's called the ADHD Foundation, they now talk more about, neurodiversity. So there's a lot of, I've put in the ADHD, dyspraxia, deicde ones. People have been making comments about, one child having ADHD and another child having something else. You'll find that most of these organizations will focus on more than one condition. And for example, there's a lot of people here from Scotland there's ADHD and Autism Scotland. So some of those groups might be more relevant. You can decide yourself whether you want to use a sort of single only condition group or something more general.
Okay, thank you. What I also noticed, and it kind of relates to the last one, and I know there's a link in the chat as well about leans, and there was a kind of, I suppose, question coming in just about how do we share. There was a question that came up from one of the parents just talking about how do we have those wider conversations in school about maybe a specific diagnosis. But I think what the leans bit, Ailbhe, you were mentioning, and I know that somebody from Salvos and Mind Room has kind of put the link in for us as well, which is great. But that in itself is a resource for developing kind of the discussion about neurodiversity within schools, within classrooms as well. Yeah, so that could be a good kind of resource for schools, for teachers to look at, because obviously we're trying to kind of understand neurodiversity in itself, and then where neurodivergence emerges as well. There's been a few questions in terms of disability, kind of when to start those conversations, and it can be, when. And also, how do I relate diagnosis and disability together? Things like that. And I suppose, in terms of the scripts I've kind of suggested tonight, but I think it's really helpful when we think about disability, that there is an Equality Act for it. And I'm merging a couple of questions into this answer, so hold on. And I hope this answers everybody. So in terms of the Equality Act 2010, it does state it's a physical or mental impairment that has a substantial and long-term negative effect on your ability to do normal daily activities. And then that kind of means that schools have a public duty. So if your child has ADHD, if they have those types of additional support needs, then the school has a public duty then to look at your child's needs. Okay, so it's probably sometimes there can be an expectation that, okay, I might have a disability, but then they should really start that might mean kind of more financial costings. But actually a lot of our schools can be geared up to provide support in classrooms and to recognise that as well, and looking at kind of what interventions that they might be able to do. In terms of disability, I think it's really important as well, like I suppose, to kind of think of the kind of concept of disability in itself. And disability, can be something that affects all of us, anybody at any point in their lives. It can be an interaction between a kind of a person and a health condition, okay, and their kind of engagement in society, and it can be, and it can be those factors about, kind of, even kind of inaccessible transportation, not getting into buildings, not having kind of social support, not having financial support, attitudes that you encounter as well. So that can be something, sometimes we think of kind of disability in quite a narrow sense of it being a physical aspect, and a lot of kids when they're really young, that's where they tend to kind of place disability in their understanding. But sometimes it's knowing, well, actually I found it really hard to kind of manage social situations. I get extremely anxious. I've got a diagnosis of ASD. That means that when I'm hearing information that I actually need time to process. So it's really starting to kind of relate it back to that individual as well. So I know some of you were saying, I don't know if I get a diagnosis, what does that mean? again, having the conversations about where your child is at and sharing those conversations is really, really important with school, with the local community, whatever they're accessing, and just making sure that, you know, you're encouraging, you know, that the child's involved in those conversations and that you're kind of encouraging their participation and inclusion where possible as well. I'm just trying to think if there was anything else that came up. Sometimes some people were talking about diagnosis, and somebody mentioned kind of traumatic birth. Now, I'm not an expert on autism, but I think it's really important to acknowledge kind of, you know, those kind of early kind of natal, postnatal experiences. And if you have other concerns that you feel are not being met by the assessment, because a diagnosis is just an outcome of assessment, that, you know, you can explore that. Or maybe if you have questions about kind of what was happening at, you know, whether it was prenatal or postnatal, is to go back and kind of explore that with your health professional as well. I think that's some of the questions. I've kind of stopped to have a look.
So I picked up one
sorry.
about an adult having ADHD and seeing signs in their child, and, you know, wondering what to do, whether to support them, etc. I think a key thing, and I think that you said that your child was 6. A key thing is then your child's at school is to talk to the teacher. So a diagnosis of ADHD comes about from corroboration from home and school. So keep that dialogue going with the school, with the class teacher, with the additional support needs teacher. They are critical. And, you know, if you so get into that conversation and they feel like they're picking up something too, that's where you can start, you know, the sort of referral process, and the school will be integral to that. So please, have dialogue with the school.
And I think just to add to that, Sinead, somebody was just saying, what do I expect from school? Again, is starting that dialogue and saying, right, how's it impacting? You know, they were just talking about their child having an ASD diagnosis, they're not attending school. It's definitely having that shared dialogue and asking what supports are available in terms of getting them to access school, you know, what's available within the school. Are there services that could maybe support a return to school? You know, what's out there? And I think that depends, you know, where we're based within the UK. Unfortunately, we all have different experience, and in Ireland, we also have different kind of systems for doing different things. But it's always, you know, return to school. And just starting to figure out, I think, the strengths, that profile that Sinead's been talking about as well, in terms of strengths, the differences, the difficulties a child might have, and their needs as well. That's always a really useful, I think, conversation point.
Yeah, and it'll depend on primary school or high school. So in high schools, we often have nurture groups where the child can actually spend their lessons there in smaller groups, you know, particularly important when there's anxiety. So it is really, really just important to have that dialogue, and really as a parent to empower yourself as much as you can with an understanding of your child, so that you can then go in and be your child's advocate. That's the most important role that you can have as a parent, is to try and understand them as best as you can and to advocate for that, you know, make it clear what you feel the strengths and difficulties are, what might be the barriers to them accessing school, and then trying to identify with them what supports are available within the school.
Okay. I think we had just a final question. What do you do if teachers don't agree with you? That's a tricky one. I think, again, bring it into, you know, who is the lead in your school for these kinds of conversations? Is it a deputy? Asking for a school meeting if, you know, possible, and probably laying out, you know, what Sinead's been talking about, strengths, difficulties, you know, advocating and knowing your child, rather than just saying, I think they've got ADHD, actually kind of getting a bit more like, well, I know they're really good at this. They have real kind of clear differences, difficulties with these areas. They need support with this. I think that's fundamentally a really helpful place to go with. And if you do need other support in terms of your own advocacy, because it is quite difficult going into meetings, I totally appreciate that. It's worth kind of looking at local advocacy groups who might be able to kind of support you in those conversations as well.
Great. So I was just going to say, finally, if you did find this very useful and you want to be added to our parent mailing list, please just email me and just say, hi, I want to be added to the parent mailing list. And I think it's 7:30 now, so I think it's always good to kind of wrap up these things when we said we would, and we could probably keep on talking for ages. So thank you so much, everyone, for coming. and hopefully we'll see you all soon at another webinar. Okay, bye.
Night, night.